Hello everyone, I am Dr. Vikas Sharma. I am a skin specialist and hair transplant surgeon. Open pores is a very common skin problem. So today in this video, let us discuss what are open pores and what are the treatments which are used for treating open pores. I will explain what all are the face washes, what are the creams that are used in the treatment, and what all are the precautions that you must observe to treat these open pores. And then we will also discuss what all are the lasers which can be used for treating open pores. In the end, I will also explain what all are the home remedies which are useful in treating open pores. So if you are suffering from open pores and you have not been able to find any good solution for treating them, please watch this video till the end and hopefully you'll be able to treat them effectively. So first, let us try to understand what are these open pores. So normally also on our skin, we have very tiny pores which are present all over the body. So through these pores, the hair of our skin, which can be baby hair or which can be thick hair, they come out of the skin. Also, with every hair, there is an associated oil gland which is present. So this oil gland also secretes some oil, and this oil also can come out of the skin through these pores. Now, these pores are normally present, as I said, but in some patients, these pores can become a little bit enlarged. In such cases, people commonly call them as open pores. Now, open pores, as I said, is a very common problem. Some patients, they confuse acne scars, like scars which form after pimples, with open pores. So in some patients, after they have acne, the skin may heal with a V-shaped depression, which are known as ice pick scars scientifically. So these ice pick scars can also look very similar to open pores. So your dermatologist can easily find out whether you have ice pick scars or open pores. You can also try to figure out whether you have open pores or ice pick scars. Open pores will be mainly seen on the central area of the face, what is commonly known as the T-zone. But ice pick scars can happen basically anywhere where you can get pimples. And the second difference is that open pores, they tend to be regularly distributed, means each open pore will have an approximately equal distance from the other skin pore. So this regular arrangement helps you to identify open pores. But ice pick scars, they can be randomly distributed. So now let's try to understand what all are the reasons for developing open or dilated pores. The first and the most important reason is aging. In our skin, there are small fiber-like proteins which are called collagen or elastin. So these fiber-like proteins, they provide strength to the skin. They provide elasticity to the skin so that it maintains its normal structure. When our age increases, the production of these proteins or these fibers, it decreases. So the structure of the skin becomes weak. It loses its elasticity. So when our skin loses elasticity, the pores on our skin, they become dilated. The next important reason is genetics. So if somebody in your family has a tendency of developing open pores, you may also have a similar tendency. The third important reason is sun damage, and it is a preventable reason. So we should try to protect our skin from sun damage. So what happens is whenever our skin is not protected by sunscreen and it is exposed to sun, after months or years of exposure, what happens is due to sun rays, the proteins in our skin, specifically elastin protein, which is like a fiber as I explained earlier, gets damaged and the production is decreased. So because of this also, the skin loses its elasticity and then it can lead to open pores as well. Next important reason is male hormones. So whenever our skin is exposed to male hormones, it tries to produce more oil. Now, as I explained, through these pores of our skin, the oil from our skin comes out. So whenever our skin is producing more oil under the influence of male hormones, these pores tend to appear larger. Now, these male hormones are not only limited to men. Women can also have some amount of male hormones in their body. And if they have some hormonal imbalance, these male hormones can be increased beyond a certain limit also. So because of exposure to these male hormones, the skin pores can appear larger. The next reason is thick hair. So as I explained, hair also come out of these skin pores. So whenever these hair are thick, the skin pores appear to be larger. Now let's discuss the treatment of open pores. So first thing that you should understand is you should apply a sunscreen very regularly. So as I explained, sun damage can lead to open pores. So when we are applying sunscreen, we should understand a few things about it. First, we should apply the sunscreen to our face at least 15 minutes before stepping out. Next, the sunscreen should be repeatedly applied, preferably every 2 to 3 hours whenever we are exposed to sunlight, so that it can continue to act and protect our skin. The third important thing is that you should apply it in generous quantity. And the fourth important thing is the SPF should be above 19. Let's discuss the face washes that are to be used when you have open pores. So face washes remove excess oil and dirt from our skin and its pores. But we should remember that we should not use any harmful or harsh face washes. Whenever we use very harsh face washes, they make our skin very dry, and this can trigger the skin to produce more oil. So we should not use very harsh face washes, and we should not try to make our skin very dry. So if you have a dry skin, you may want to use a gentle skin cleanser. If you have an oily skin, you may want to use something which has alpha hydroxy or beta hydroxy acids, for example glycolic acid, lactic acid, or salicylic acid. All these acids, they remove the dead skin cells, they remove the dirt from your skin pores, and they clean up the skin. In addition, salicylic acid also reduces the production of oil from your oil glands, so this also helps. Now let's discuss the role of toners and astringents. A lot of patients want to use them. So it has been seen that they do reduce the size of your skin pores temporarily, but you should remember that you should not make your skin too dry by using all these toners and astringents. So if you have a dry skin, you should use them less frequently, maybe once or twice a week is enough. If you use them too frequently, then your skin can become very dry, as I said. If you have an oily skin, it's okay, you can increase the frequency of the toners and astringents, but again, you should remember that your skin should not become too dry. Next important thing is that the makeup that you are using should be water based and it should be non-comedogenic. Also, you should try to understand that wearing makeup for a very long period of time is not good for your skin, so you should remove it as soon as possible. Now let's discuss the medical treatment for open pores. The most important creams are retinoids. So retinoids are basically vitamin A like medicines which are to be applied to your skin. So commonly you will see these retinoid creams will contain either tretinoin or adapalene. Now these creams, they help in the superficial repair of the skin as well, and they also help the deeper layers of the skin. Superficial layers, they remove the fine lines, they remove the wrinkles, the fine wrinkles that are developing. Also they have some anti-aging effects. Also they help in the deeper layers. So as I had explained, the deeper layers contain some fiber like proteins which help in the structural integrity of our skin. So these proteins are remodeled, means they are repaired with the help of these creams. Also it increases the production of these proteins so that our skin becomes tougher. These retinoids, they also decrease the production of oil in your skin, so this can help in reducing the size of the open pores. Now these creams also have certain side effects. So these creams can make your skin very dry, sensitive, itchy, so you should use them under a doctor's supervision. The second important side effect is that these creams cannot be used by pregnant women because it can be harmful for the developing baby. So never use these creams without a doctor's prescription. The second important method for treating open pores is chemical peels. So in chemical peels, certain lotions which have mild acids, these are applied to your face for a certain amount of time and then they are washed off. These peels can contain glycolic acid or salicylic acid. These peels, they reduce the activity of your oil glands, they remove the superficial layers of the skin which have dead cells or dirt, and they clean up the pores, and also they help in remodeling of the skin. So the proteins inside the skin, they also become tougher and stronger so that your skin regains its structural strength. With these chemical peels, vitamin C can also be combined. So vitamin C has a very important role in the production of collagen proteins, so it can be used as a serum as well. Next, if somebody has a hormonal imbalance, the patients may be prescribed spironolactone or cyproterone. So these medicines can help in improving the hormonal imbalance and they can help in open pores as well. These medicines can have certain side effects, so you should never use them without your doctor's supervision. Then there are certain procedures which can help you with open pores. So there are fractional lasers, there is microneedling radiofrequency, and then there is microneedling, which means derma roller and derma pen. So all these procedures can help you with open pores as well. So let's try to understand how these procedures work. Basically, these procedures, they injure your skin in a net-like pattern. Basically, they'll injure very small areas of your face and leave the rest of the skin intact. So whenever skin is injured in a net-like pattern, the surrounding skin which has not been treated helps in the recovery of the treated or injured skin. So when the surrounding skin tries to repair the injured skin, it promotes the production of new collagen, which is tougher than the old collagen, and this helps in the structural integrity, the tensile strength of your skin, and your skin becomes tougher and the open pore size decreases. Now, these treatments, they require multiple sessions, usually 4 to 6 sessions, with 1 month interval between each session. Then these treatments can have certain side effects. Temporary side effects like redness can happen. This can persist for around 5 to 7 days. Then some patients with a darker skin type can also develop pigmentation as a result of these treatments, which is usually reversible, and it can be easily treated with the help of skin lightening creams and sunscreens. Then the next treatment is carbon pore laser, which is very popular. So in this, what is done is a black carbon lotion is applied to your face, and then it is treated with the laser. This laser, it targets black color. So this lotion, which is present in your skin pores, also gets heated up because of this laser. When it gets heated up, the skin is injured, similar to the lasers that we were discussing earlier. So when your skin gets injured, it tries to promote the production of new collagen, and this makes your skin tougher again. Carbon pore therapy can also reduce dark spots on your face. It is very safe, and as a result, it's very popular. The redness from this therapy usually lasts for 1 or 2 days only, and there may be slight peeling for 1 or 2 days. Other than that, it's usually very safe. So, out of these therapies, in my personal opinion and experience, the most effective are fractional lasers, that is, fractional carbon dioxide laser and fractional erbium yak laser, and also carbon pore therapy. The results of these treatments also tend to be longer lasting than other methods. So, this was all about open pores on your face. If I have missed anything, if I have not been able to discuss anything that you wanted to know about, please let me know in the comment section below. I will try to reply to all your questions.
Please subscribe to our channel, and for more such videos and information, please click on the bell icon. You can also follow us on Facebook, Twitter and Instagram.